In a real gunshot emergency, panic kills faster than the injury. The truth is brutal. Only specific actions matter in those first minutes, and missing them can cost everything. What happens in the first few minutes after a serious injury is not random. It follows patterns that medical professionals have studied for decades. Emergency medicine, trauma systems, and military research all point to the same conclusion. Early actions taken before advanced care arrives are often the deciding factor. That doesn't mean someone needs advanced equipment or years of training. It means the order of actions matters more than anything else. The body begins to respond immediately when it is injured. Blood circulation can drop, breathing can become less effective, and the body starts losing heat faster than normal. These are not separate problems that happen one after the other. They happen together, and they interact with each other in ways that make the situation worse if not addressed correctly. That is why trained responders don't try to fix everything at once. They follow a structured priority system because doing the wrong thing first wastes time that cannot be recovered. Understanding this changes how a person reacts. Instead of guessing or reacting emotionally, the focus shifts to what actually keeps the body stable. That is the difference between random action and purposeful action. Most people don't fail because they don't care. They fail because they don't know where to start. The biggest mistake people make immediately. One of the most common patterns seen in emergencies is people focusing on what looks dramatic instead of what is actually dangerous. A visible injury can pull attention away from something more critical. That instinct is natural, but it can lead to poor decisions. There is also a strong tendency to hesitate. People worry about doing something wrong, causing pain, or making the situation worse. That hesitation often leads to inaction, and in time sensitive situations, inaction can be more harmful than imperfect action. Emergency response training emphasizes that doing something effective quickly is better than waiting for a perfect solution that never comes. Another issue is trying to do too many things at once. Checking everything, moving the injured person unnecessarily, or searching for supplies before addressing the immediate problem can delay the most important intervention. The body does not pause while decisions are being made. It continues to lose stability. The key takeaway here is that urgency must be paired with clarity. Acting fast is important, but acting in the right order is what actually makes the difference. Why controlling bleeding comes first. Medical data consistently shows that uncontrolled external bleeding is one of the most preventable causes of death in trauma. That is why it is always addressed first in emergency protocols. The reason is straightforward. Blood carries oxygen, and oxygen is required for organs to function. When blood loss becomes severe, the body cannot maintain that function. The most effective first step is direct pressure. This means applying firm and continuous pressure directly to the source of bleeding. It is not light contact. It requires enough force to slow or stop the flow. Many people hesitate at this step because they are unsure how much pressure to apply, but hesitation reduces effectiveness. If direct pressure is not enough, wound packing can be used. This involves placing gauze or cloth into the wound to help control bleeding from within. This technique is taught in programs like Stop the Bleed and is supported by the American College of Surgeons. It is simple, but it requires decisiveness. For injuries involving limbs, tourniquets are widely recognized as effective tools. When applied correctly, they can stop blood flow to a damaged area and prevent further loss. Modern research has shown that properly used tourniquets are safe and life-saving in appropriate situations. The most important factor in all of these methods is speed. Acting quickly to control bleeding significantly improves the chances of stabilization. Breathing problems are not always obvious. After addressing severe bleeding, the next priority is ensuring effective breathing. This is where situations become more complex because breathing issues are not always obvious. A person may appear to be breathing, but not effectively enough to support the body. Injuries to the chest can interfere with normal lung function. When air enters spaces where it should not, it can prevent the lungs from expanding properly. This can worsen over time if not managed. One of the recognized approaches in field care is sealing open chest wounds to prevent air from entering the chest cavity. This can be done using specialized chest seals or improvised materials that create an airtight barrier. The goal is not to fix the underlying problem, but to prevent it from getting worse. This is an important distinction because it reinforces the idea that field care is about stabilization, not complete treatment. Advanced procedures related to breathing are performed by trained professionals because they require precision and carry risks if done incorrectly. Understanding these limits is part of effective response. Knowing what not to attempt is just as important as knowing what to do. Shock is silent but dangerous. Shock is one of the most critical conditions in trauma, and it is often misunderstood. It is not simply a feeling of weakness or dizziness. It is a state where the body cannot circulate blood effectively, leading to reduced oxygen delivery to vital organs. What makes shock particularly dangerous is that it can develop even after visible bleeding is controlled. The body has already lost volume and it is struggling to maintain stability. Signs can include pale or cool skin, rapid breathing, confusion, and weakness. Managing shock in the field focuses on support. Keeping the person lying flat helps maintain blood flow to the brain. Avoiding unnecessary movement prevents additional strain on the body. Providing reassurance can also help reduce stress, which in turn can lower heart rate and improve overall stability. These actions may seem simple, but they are grounded in medical understanding of how the body responds to trauma. Small steps can have a significant impact when applied correctly. Why keeping warm matters more than you think. Temperature management is often overlooked, but it plays a critical role in trauma care. The body can lose heat rapidly after an injury, even in environments that do not feel cold. This happens because blood loss and exposure reduce the body's ability to regulate temperature. Hypothermia affects the body's ability to clot blood. When the body temperature drops, clotting mechanisms become less effective. This can lead to continued bleeding, creating a cycle where blood loss leads to heat loss, and heat loss leads to more bleeding. Using available materials to retain warmth is an essential step. This can include blankets, jackets, or any form of insulation. The goal is to prevent further heat loss and support the body's natural processes. This step is often skipped because it does not feel urgent compared to other actions. However, medical research shows that it is an integral part of effective trauma care. The turning point. Most people miss. At this stage, it becomes clear that survival depends on a sequence of actions rather than a single dramatic intervention. Each step supports the next, and skipping one can reduce the effectiveness of the others. This is where understanding becomes practical. It is not about memorizing complex procedures, it is about remembering the order and acting with purpose. That clarity reduces hesitation and improves response under pressure. If this kind of breakdown is helping you see things differently, take a moment to subscribe. It keeps this kind of content coming without turning it into noise. The reason this matters is because knowledge without application does not change outcomes. The brain needs clear patterns to follow in high-pressure situations. That is what this sequence provides. What you should never do. There are several actions that consistently lead to worse outcomes. One of the most important is attempting to remove objects from a wound. Unless done in a controlled medical setting, this can increase bleeding and cause additional damage. Giving food or water is another common mistake. While it may seem helpful, it can create complications if surgical care becomes necessary. This is a detail that is often overlooked, but it reflects a broader principle of avoiding actions that interfere with medical treatment. Unnecessary movement is also a concern. Moving the injured person can disrupt clots and increase bleeding. Unless there is immediate danger in the environment, keeping movement to a minimum is usually the safer choice. These points are not restrictions. They are guidelines based on observed outcomes in real-world cases. The reality of limited resources. It is important to recognize the limits of what can be done without professional care. Field interventions are designed to stabilize, not to fully treat. Internal injuries and complex conditions require advanced medical intervention. This does not reduce the importance of early actions. It highlights their role in extending the window of survival. Each correct step increases the likelihood that the person can reach advanced care in a stable condition. Training programs emphasize simplicity for this reason. The fewer decisions that need to be made in the moment, the more effective the response will be. If you want to go deeper into how the body reacts under stress and why these priorities matter, there is another video that breaks it down step by step. That is where the full picture becomes clear.